Wear the Gown is sponsored by CHI St. Vincent.
As we continue to report on the coronavirus, it's easy to lose sight of the health risks that's right in front of us. We're talking about the flu. It's why our Gown Talk this morning focuses on the most vulnerable among us. We're talking about our kids. Here's Craig O'Neill.
We are not out of the woods yet. Type A and B flu strains continue to be a threat, especially to kids. At CHI St. Vincent West, pediatrician Dr. Joe Elser sums it up this way.
There's a lot more flu, but maybe a little less severe than usual.
And yet, there are special groups of kids that need extra attention.
And that includes kids less than 2, kids that have chronic medical problems, specifically asthma, diabetes, any kind of cancer. Even overweight kids are a little bit more at a risk to have complications from the flu as well.
And for the children not in any of those groups, the issue then becomes when to take them in to see the doctor.
If a child has fever, cough, congestion like other viruses do, and they treat symptoms and they seem better, then they don't necessarily need to be seen.
But they do need to stay home from school. Keeping sick kids away from healthy ones prevents the spread. Keep them home until...
is fever-free for 24 hours without treatment.
And if the fever breaks, but the cough doesn't...
You can cough for 2 weeks after having the flu, but as long as we don't have fever, we're past the contagious stage.
It's that contagious stage that has Dr. Elser looking forward to spring break.
You know, the best thing that happens is when school's let out for a few days and you keep people away from everybody, we see kind of a dip in the whole incidence of flu.
But you can't keep closing schools forever.
If we really want to restrict the spread, not only do we keep sick people away from well people, but we just make sure we wash our hands.
And doctors continue to try and give kids their best shot.
Critical that they get the flu shot. We give the flu shot in kids as young as 6 months.
The shots, the hand washing, watching for headaches, body aches, cough, congestion, and the big indicator, fever.
I tell parents we treat fever, but we don't chase fever. So fever's the body's way to help fight the infection. It's not important for a child to be fever-free. It's important that they feel good.
And the better our kids feel, the better for us all.
Approximately 41 schools have closed at one time or another this year because of the flu. Arkansas has had one child die so far. Experts say that is one too many.